everyone. We at OnSite Health recognize the importance of mental health awareness in the workplace. For years, mental health has been ignored and given low priority. According to the National Alliance on Mental Illness, otherwise known as NAMI, 1 in 5 people per year report a mental health issue, but only half of them receive some form of mental health intervention. This can be for many reasons, such as denial, shame, lack of confidence in the medical and mental health systems, lack of resources, and the fear of stigma attached to mental illness. NAMI also reports that it takes a person 11 years from the onset of their mental health symptoms to their first encounter with a mental health professional. When I was in nursing school, they called me the call light queen, because whenever I saw a call light go off, I would race to the room to inquire with the patient what they needed. It was my belief that a patient likely suffered for several minutes or longer before finally seeking help. Imagine living with unbearable mental health symptoms for 11 years before finally reaching out for help. If this were a wound, the person would have likely died from infection. But because it is a mental health issue and not always visible to others or even ourselves, our mental health symptoms are able to fester until it's no longer possible to function well on a daily basis. Only 50% of Americans report being familiar with the mental health system, according to NAMI. Given that people spend half their day at work, it's important to make clear to your employees what kinds of mental resources are available to them. Utilizing your workplace nurse to promote your EAP program and to help identify people at risk so that they can receive early intervention are of utmost importance. Educating employees on how to utilize their mental health benefits is also very important, as well as encouraging use of those benefits when needed. Not everyone, or even most people who have mental health symptoms, need medication. According to the helpguide.org, 75% of people who receive psychotherapy saw improvements in their emotional and psychological well-being. Talking to your insurance representatives about adding mental health benefits to include therapy to your company plan not only is prudent, but can help to provide those suffering from mental health symptoms with the tools they need to realize long-term success in the reduction of their symptoms. According to a 2023 Mental Health America survey, almost a third of adults with mental health conditions reported not being able to get the treatment they needed, with a significant portion struggling to access services due to cost. OnSite Health has a saying, you're going to pay it now or pay it later. If your benefits do not include a robust mental health component, without intervention, these mental health issues can and likely will develop to present themselves in physical form. Medical conditions such as GERD, stomach ulcers and cancer, heart disease including heart attacks and stroke, high blood pressure, unstable blood sugars, migraine headaches, and asthma are just a few issues that can be caused or made worse by poor mental health. Remember, an ounce of prevention is worth a pound of cure. Plan your benefits to include up to or as close to 15 to 20 therapy sessions, which is the average number of therapy sessions needed for people to get relief from their symptoms, according to the American Psychological Association. Providing information to your employees in different formats is important to reach everyone equally. Utilizing flyers, mailers, brochures, break room TVs, first aid stations, locker rooms, and holding lunchtime seminars are great ways to reach out to all of your employees. Training supervisory staff to help identify when an employee needs intervention is also helpful and can be done in simple training sessions at work by your nursing staff. OnSite Health would like to partner with you to help raise awareness and encourage people to seek professional help when needed. There is no reason a person should suffer from acute bronchitis or symptoms of chronic arthritis, nor should they suffer from mental health symptoms. Please reach out to us to let us know how we can help. In the meantime, I hope this video has provided you with some insight into the prevalence of mental health issues in our country and the need for effective interventions. Thank you so much for your time. Be well.